early breast cancer treatment, which is an alternative to surgery, something that I actually offer on occasion, not all the time because we've kind of reduced the number of breast disease patients we're seeing overall, but I want to kind of get into this thing called cryoablation, which involves freezing a tumor in the breast. So when you think about tumors in any woman's breast, it could even also be a man's breast, because I do see breast cancer in men as well. So in anybody who develops a breast cancer, the question that always needs to be made during the diagnosis stage is this an early stage cancer? Is this something that we're catching at a very early point in time where it's a small lesion, it's a small tumor, or has it grown? Has it spread? Has it spread to what we call the lymph nodes? Has it spread elsewhere in your body? Sometimes I see it spreading to the bones. I see it spreading throughout your body. So if we find a patient who has early stage, low risk breast cancer, that's where you have to decide, do you want to have something that's done minimally invasively, or do you want a surgery for it? So what would a surgeon do? A surgeon would typically go in, make a small little incision over the lesion, the tumor, and go in, doesn't have to go super deep, goes in and takes out that mass, creates a nice little margin of tissue around it to make sure that they have captured the entirety of that breast cancer. Now, there are new options that are out there. They've actually been out there for quite a while. Usually we have used this option called cryoablation, which is freezing the tumor. That means that I'm putting a needle in through the skin tissue into that mass, and I freeze it. And usually we've done it for painful breast masses that are not as deadly, like a fibroadenoma that you might see in a younger patient, but now people are applying it for tumors, actual breast cancers. And so that's what came out actually. So the FDA panel recently approved cryoablation as an alternative, an adequate alternative to open breast surgery.